Intended as a complex psychological and physiological process, addiction manifests in any behavior, whether it's drug use, sex, gambling, internet activities, shopping, eating, work, extreme sports, or pornography. It's enjoyable in the short term, provides relief, and creates craving, yet leads to suffering and negative consequences in the long run, with a persistent inability to stop.
Most of our content at Health Clips Daily focuses on quick, actionable advice for physical health, fitness, and mental well-being. This video fills a critical gap by explaining addiction through a trauma-informed lens, highlighting childhood experiences, emotional disconnection, and the need for genuine recovery.
The official definition of addiction from the American Society for Addiction Medicine describes it as a primary brain disorder, largely genetic, which many assume makes addiction a choice or a disease, rooted solely in genetics. But the speaker challenges this, emphasizing that addiction is often not primarily genetic nor solely a brain disorder in origin. He introduces the idea that human beings have two essential needs from childhood: attachment and authenticity. Attachment is the drive for closeness and proximity with caregivers, vital for survival. Endorphins, which mimic the body's natural opiates, facilitate this attachment. For example, if you take infant mice and block their endorphin receptors, they won't cry for help or seek their mother, highlighting that early trauma and stress can impair this system. When people use heroin, for instance, it mimics these endorphins, creating feelings of love and connection, explaining why addiction feels so powerful and comforting, like a warm, soft hug. We also need authenticity, being connected to ourselves, trusting our gut feelings, and acting based on our internal cues. Evolutionarily, in a world where humans lived in the wild far longer than in cities, survival relied heavily on gut feelings. If you suppress authentic emotions, such as anger, because your parents couldn't handle them or made you feel unliked, you learn to disconnect from your true self. Over time, this disconnection causes confusion about identity, existential questioning, and psychological suffering, an internal conflict between attachment needs and the desire for authenticity. This dynamic means that in modern society, staying authentic can threaten attachment relationships, especially when childhood trauma complicates emotional expression. As a result, many give up their authenticity to maintain connection, leading to losing touch with their true selves. This loss is what the speaker describes as trauma, disconnecting from emotions, body awareness, and living in negative worldviews and defensive patterns that influence adult behaviors. Trauma, he clarifies, isn't just what happens externally, divorce, abuse, or loss, but the internal aftermath, that disconnection from emotions and present moment awareness. This internal trauma shapes the perspectives we carry into adulthood, often manifesting as addiction, which is an attempt to temporarily fix these disconnections and emotional pain. He emphasizes that addiction isn't the primary issue, but a coping mechanism rooted in childhood trauma. Heroin, for example, provides a feeling like a deep, loving hug because it mimics endorphins that facilitate attachment, a fundamental human need. If these traumas aren't addressed, addiction worsens disconnection over time. The speaker advocates that healing and recovery come from reconnecting, restoring access to our emotions and body awareness, which have been lost. Addressing childhood pain and trauma involves recognizing how these manifest in the present and transcending them by reconnecting with ourselves. Recovery, in essence, is about finding and rediscovering ourselves, because the loss of self is the core of trauma. He concludes that the true purpose of mental health treatment and healing is reconnection,